Hello, good morning. I am Georgina Ndkwezanika. Welcome to COVID-19 update on Silverbird Television. This program is brought to you courtesy the WASH campaign, the Widows and Orphans Empowerment Organization in association with USAID. That is the United States Agency International Development Effective Water Sanitation and Hygiene e-wash program, and it is meant to carry out a COVID-19 prevention campaign. Now, on the program, we are creating awareness on how we can prevent ourselves from getting infected, and knowing that that a lot of infections are going around. We need to be careful to ensure that we end or curb the spread of the deadly COVID-19 coronavirus in Nigeria. Now, moving ahead, we will be looking at some of the figures. The numbers are continuing to rise. As at 12th of December 2020, 670 new cases were reported from 15 states, including Lagos. Lagos has the highest number of 225. We have FCT 108, Kaduna 125, I think, and Ekiti we have 4, Bayelsa 3, Ogun 3, Plateau 3, Akwa Ibom 2, Delta 1, and Sokoto 1 as well. Till date, 772,757 cases have been confirmed. 65,850 cases have been discharged, while 1,194 deaths have been recorded in 36 states of the Federation and the FCT. We want to continue to remind Nigerians that it is important to keep observing the laid down health protocols, create more awareness on the importance of maintaining good hygiene to prevent further spread of the disease. And what better way to create this awareness than to bring someone who has gone through this experience and has recovered, and will tell us what his experience was like. He's going to share with us what we need to do to ensure that we do not get infected. We have with us in the studio, or have with me in the studio, Salim Salau, who has been, who has just recovered. Oh no, you did not just recover. Yes, but you actually have recovered from COVID-19 infection. So you're in a good position to tell Nigerians out there who still don't believe that infections are ongoing, that they have to be careful. Welcome to the program.
Thank you.
All right, let's start off first with your experience. At what point did you realize that you had COVID-19?
I have COVID-19 when we are doing community testing in the FCT, intensive community testing and creation of awareness. We went to Pape community, Gariki community, Mabushi community, Lube community. We did community testing, but I realized I had COVID-19 when we went to Mabushi community, because it's the hotspot then, as at April, for COVID-19. The first day we went, we have like 3 cases. We are like, The next day, 10 cases. The next day, 4 cases. Then people are afraid to come in. Now, why I was exposed is I have to link with the community leaders.
Okay.
So they will beg people to come for the testing. We have to create awareness and everything there. After then, I start developing sore throat, my pain in my throat. Then I thought that time is fasting period. I thought maybe it's fasting or something like that. I told my supervisor, I'm having sore throat too. He said, okay, go and test yourself. I said, no problem. The next community testing is Gariki community. As I went there, then I start feeling fatigue and nausea. I said, no, I have to test myself. Then I got tested. My result came out in 2 days. I am still with my uncle, though with social distance. I'm seeing someone, there is one software that they used to update result. I used to update, then I saw Salim Salau confirmed. Wow. I now show him. They confirmed me positive. He said, no, call the office and confirm and be sure. I called them. Then they were afraid. No, it's not you, it's not you. I said, I saw my name confirmed. Let them, okay, they said, let them call. They now call. They said, the result is not yet out. Then the other guy called me that retesting is recommended. I said, why? I know the procedure for retesting. the result have to be indeterminate first before they retest you. Then I now call the health of the EPID. She said, tell me your result is positive. Oh, I said, okay. Can I go to the isolation center now? They said, no, tomorrow. Then I now isolate myself in the house. The next day, I carried my car to the office that they must take me to isolation center. Oh. They now come, they will make arrangement. Later, they now took me to the isolation center. I went there, and in 5 days, they test me, I have converted. I said, okay, no problem. But actually, COVID-19 is bad experience. Seriously.
Wow. Okay, so you actually mentioned the symptoms you had. You had fatigue, you had sore throat.
And nausea.
And nausea. All right. Now, so many people may have similar symptoms and may not be entirely COVID-19 infected. So, well, how do you distinguish between the symptoms, or is it just safe to just go and get tested?
Yes, that is the problem we're having now at hand. People are developing symptoms like fever, loss of smell, loss of taste. They will say it's malaria. Some, if they have this loss of smell, they will say, it's normal catarrh. But if they go and test, it's positive. Though I did not tell you, I had loss of smell too. But that time, loss of smell was not among the symptoms. Yeah. It's after I went to isolation center, then people are complaining of loss of smell. Then I now called the office that, see what they said, yes, they have seen the article that need people in other countries are doing this, and then they now put the symptoms there. But let me tell you now, because we are not following the guidelines, NCDC guideline in protection of this COVID-19, that's why you are seeing these cases arising. For example, as I come to this your place, even downstairs, nobody is wearing face masks. If you go to market, nobody is wearing face masks. No social distance. That's why you see the cases. We have almost 60% positivity of the...
Of almost all the cases that present for testing?
Yes.
Wow.
If you test 100 people, at least 50, 60 people, you see them positive. Why? Because we are not following the guidelines.
Now that you've recovered, I know we discussed this off camera, but I would like for you to speak about it. Are you worried about the possibility of getting reinfected? Just, tell us what you think about this.
Yes. I think now, I'm even up to now, I'm part of the FCT sample collectors and case investigators. I think I'm more protective than other of my colleagues. They are protective, but me, I fear the virus
because you've already gone through it.
I don't want to take any chances because I thought before it is very difficult for you to be reinfected. But I knew 2 people that are reinfected. They tested positive, they have recovered, and they have now tested positive again, which means I have ruled out reinfection.
So there is a possibility that when you recover...
There is 100% possibility to me. That is why I will not take any chance of exposing myself to COVID-19.
So aside from washing your hands, wearing your face mask, what other measures do you usually take to protect yourself? Probably maybe your diet and kind of food you eat,
yes,
keeping healthy and all that.
This COVID-19, it weakens the immunity. It weakens the immunity so much, which is why I'm not praying for my worst enemy to contact this virus. The only thing is you have to be taking a lot of fruits and vegetables, then fruits again. Because COVID-19 experience is not good for everybody to have it. Because sometimes, somebody like me, the time I contacted the virus, I had mild symptoms. But after I have recovered, with 1 week, then I have started developing something again. I have body pain, loss of taste. I said, what happened? I then went and tested. I tested negative. They now tell me, no, it's the virus that have already weakened you. Which is why some people now, we don't want to take chance. If you develop any of the symptoms, coughing, sore throat, nausea, vomiting, loss of smell, loss of taste, high temperature, any one of them, go and test, because you don't know whether you have any comorbidity. That's why you have seen people are dying. If they test them, They test the dead body, you see that they are COVID-19 positive.
Wow. Wow.
Some people will be developing the symptoms after like 14 days or 15 days. They have suffered. If you test them, you see that it's negative. Why? That's what they call, is it auto-convert.
Okay.
But at the end of the day, they will be feeling weakness of the body. The thing will just be weakening them. They have to take time before they will recover fully.
Okay.
Which is why if you have any of these symptoms that I've mentioned, you have to go for a test, and the test is free.
Okay, so you heard it, the test is free. Make sure you go for a test if you develop any of those symptoms he mentioned: coughing, sore throat, weakness of the body, nausea, vomiting as well. You can be a part of this conversation by calling the studio line 081-058-30411, 081-058-30411, 081-058-30411 is the number for you to call to be a part of this conversation. If you are watching, this is a COVID-19 update on Silverbird Television with my guest, Salim. And I would love for you to talk some more about being careful, observing the health protocols for now. You've rightly mentioned that there are so many people who are not observing, probably because they feel that it's not, it can't affect them. It's maybe people in there's a circle of people, you know, the big men, so to speak, or the elites are the ones that are most affected by this. So why don't you talk to Nigerians, tell them this is why you need to be careful. We cannot get tired of emphasizing this. Please go ahead.
Which is why in the FCT administration, especially the public health department, we used to do intensive community awareness. We used to go to each and every community in the FCT to create awareness on this COVID-19, because most of the people that don't believe COVID-19 is real is people in the communities, especially in the villages. This one is for rich people, this is for... But the problem is some of them have some comorbidities. They are dying without knowing what is the cause of the death. Yes, we are lucky in Nigeria. The strain, I think, is not that much. But if you have comorbidity, it's much, because people are dying of COVID-19. As you see from the 1,000s, this one is documented. There are some people that are not testing. But to me, the only thing is observe social distance, proper use of face masks, not just using of face masks, proper using of face masks. You know, you can use face masks, somebody will use face masks and just be rubbing the face mask and be touching, or after using the face mask, he'll just put the face mask inside his pocket and remove it and put it again. He might infect himself.
I have observed even some of us are even guilty. You wear your face mask and you pull it down to your chin, or you let it hang, or you I don't know. You see different ways, and you go into public places. So you are with the face mask quite alright, but instead of you to cover your mouth with it or cover your nose with it, it's here, it's on your chin. So what's well, it's as good as not wearing it.
Yes, and sometimes, like now, if someone sneezes on your face mask, it have protect you from getting the virus. But the problem is, you can come and do like this and touch your face. There's proper use of face mask and proper way of removing and disposing the face mask. If you want to reuse it again, you can reuse it by decontaminating it.
And that's why we need to always be with our hand sanitizers as well.
Yes.
Okay, we were discussing earlier about schools and your concerns of infection rate among young people, those in children and those in secondary schools as well, especially in the boarding school. Talk to us about that.
Yes. What really happened is, in the boarding school, the teachers are trying their best in the class to see that there is social distance. But inside the hostels, they cannot. And sometimes, some of the students might develop malaria or fever. They will think it's malaria. They will just allow them to mingle with the other people. Then they later confirm them positive. and they will send them back to their houses instead of isolating them in the isolation center or somewhere else.
Or sending them to the hospital.
Or to the hospitals. No, to the hospitals too. They have to be isolation center in there.
Okay.
They will end up infecting the students, infecting their family members, infecting their teachers as well, infecting the nurses in the school as well, which we are having those cases in the FCT.
Okay. You recover from COVID-19 quite all right. Were there any form of the stigmatization you experienced?
Yes, I experienced social stigmatization. There is residential stigmatization, the residential area you are living. There's community stigmatization, but I have never experienced organizational stigmatization because
probably where you work, they are more aware.
After they are more aware, they know we are into it because we are in the emergency response team in the FCT. Nobody is safe, and it's not only me. Everybody can get it. They knew the, but there is self-stigmatization too.
I'm just hearing that self-stigmatization.
Yes, I had self-stigmatization in the sense that what causes that is fear of responsibility.
Oh, okay. Okay.
I don't want to be responsible for infecting my family members.
Okay.
You'll be stigmatized. I don't want this person to. Do you understand?
I understand. I understand. I understand that concern. Like, look, I don't want any of my family members to have this.
And what causes the community stigmatization is misinformation, and sometimes people lack trust in the treatment of COVID-19. What did they give you? Is it not only antimalarial drugs they give you? They just want to. Is it not only this they give you? They lack trust in the treatment of the COVID-19. And some, they lack the knowledge, especially in the rural communities. But we are still going for that. As we said, stigmatization, there is a point that even the driver that is driving us, his people that are eating food together, if they see him, they will just run away.
Oh dear.
The person that is washing our car, they deny him access to fetch water from their tap because person in the house that is washing car is infected. You see, there is stigma. But the way forward is to assess the level of stigma and to work on it.
Work on it.
Yes.
Yeah. And then to also tell people that it's important that they know that once you've recovered, rather than stigmatize, they should even support you. I mean, I don't know how well your family supported you, you know, support system, because people need that.
That is why my organization really supported me, because I was the first person officially health worker that contacted the virus in the FCT officially. That is why all of them, they were all afraid. Some are crying. As I come back, many people are coming. Hey, don't come back, because they said they will drop me somewhere. I said, why? Did I kill anybody? I want to be dropped inside the office.
Okay.
And they really show love and concern because they trusted the treatment. But people in the communities, you are resident. Is this COVID-19? If you see them, good morning, good morning, they'll just be moving back.
I understand somebody who, you know, had to be, I think her landlord ejected her or something, just because she has recovered actually, but because she was reported to have gotten infected, you know. So these are the things people face every day, and that's why so many people would not want to come out the moment they get infected. And
why the people in my organization really show concern is, I did not stigmatize myself there, and I show myself. You know, some people will just be hiding, and some people will go and test with different name and with their number. If they call them they are positive, then they will now start taking. Do you understand? But I now call them I'm positive. They should take me to isolation center. I went there with my car, so that they will take me, because they have to take you with ambulance to the isolation center before they will accept you. I went there, but the only stigma I have is that fear of responsibility. But as soon as I had that. They tested all my family members and they were all negative.
Negative, great.
Then I slept well. Why? Because as I enter house, my cousins, even my friend that we are sleeping together, I don't used to like even shaking them or to sit close to them. As I come, I just go direct
straight
to toilet.
Okay, toilet, yeah.
Direct.
Go.
And disinfect. I have this to disinfect myself. If I remove that cloth, I'll just put it in washing machine.
Immediately.
Immediately. And if I come, I don't want them to come close to me. Because I know the thing I'm doing.
Yeah, yeah.
Because community testing is one kind.
You're more at risk because you're out there.
You don't know the people.
In
fact, they don't trust the COVID-19. If you call them that they had COVID-19, they will just tell you, no, it's not there. But our fear is you might develop the virus, I might develop the virus without symptoms. But how about your husband? How about your mother? How about your father that you are living with? They might have diabetes, they might have heart attack, they might have asthma.
True.
If you transmit the virus to them, you can kill them.
Yeah. Okay. At this point, let's get to hear from you what your advice would be to Nigerians, especially those who are flouting the prevention guidelines for COVID-19. What would you tell them? We will keep on emphasizing and re-emphasizing on this particular question. We need to bend the curve of transmission, the cases. We need to reduce the number of infection or the infection rates we are having in Nigeria. And for us to do that, there has to be total compliance with the COVID-19 guideline. And yes, I am pledging that I will ensure I observe, this is a self-pledge now, I'm pledging on air that I will ensure that I stick to the guidelines regarding the safety protocols. So please, what would you tell Nigerians at this point?
The only thing I will tell them is the things I've been telling everybody. They have to follow NCDC guideline. 1, mass gathering. They have to avoid mass gathering of any kind. Washing hands. Using hand sanitizer, surface sanitizer. Proper using of face mask, not using of face mask. Proper using of face mask.
Okay. Proper use of face mask, hand sanitizers, washing of hands. Isolate yourself if you feel any of the symptoms, most especially the symptoms that we've mentioned. The sore throat, if you experience sore throat, if you have catarrh, if you experience nausea or you're vomiting as well, temperature, high temperature, body ache and all that, please ensure that you avail yourself for testing to be sure that it's either you're infected or not. When you get your test results, then you know what next to do. They say it's better to be informed than to be disformed, or deformed rather. All right, so it's COVID-19 update on Silverbird Television. We still have a few minutes to go. If you do have if you have questions to ask or comments to make, or you want to talk to our guests, please do call in and let's get to hear from you. The number is on the screen at this point in time, so call in and let us get to know what your questions are. And to my guest, Salim, I want you to talk to parents, especially those who have children in boarding schools or those who have day children. What do they do every time this child goes to school and comes back to the house? What are the first steps to take, to ensure that they do not infect others in the house?
Yes, the only advice I will give is, sometimes they are children. The only thing is, when they are going to school, is mentor them on the proper use of face masks and taking personal hygiene very, very serious. After they come back, the first thing that they will do, they should just go straight to the toilet and wash their hands, remove their uniform and put it inside, whether washing machine or waste bin there, so that, and take their bath before coming out. And there is one thing I want to add. For this, if you had all these symptoms, we have many testing centers in the FCT. You have to choose the one nearest to you. And as I said, COVID-19 testing is free in the FCT.
Okay.
In Nigeria at large, is free.
Okay. Okay.
We have, if you are in the central area, you can go to FCT Public Health Department, number 8 Orlo Street. If you are in Jaibi Life Council, you can go to FMC Jaibi. We have Maitama District Hospital. We have Nyanya General Hospital. We have Kubwa General Hospital. They're also testing. We have DSS. They're also testing. Gwagwalada Teaching Hospital. They're also testing there. If you had any of these symptoms, you have to go there for your test. Okay.
Okay, so please do go to any of the centers close to you and ensure that you are tested. You are, tested to be sure of your status. COVID-19 is a deadly disease. You need to take safety measures. I am Georgina Ndukwezanka, and I've been speaking with my guests.
Salim Salau.
Salim Salau, thank you so much for being with us on the program. You have to take responsibility for your safety and the safety of others. Ensure that you, observe the safety protocols in order to ensure you don't get infected and you do not infect other people. This is the COVID-19 prevention campaign brought to you by the Women and Orphans Empowerment Organization in collaboration with USAID eWASH program. Okay, so next week or this week Wednesday will be another edition of the program. Just ensure that you join us, because we'll be bringing you so many other issues regarding prevention of COVID-19 here in Abuja. Thank you so much and have a wonderful day.